This recording covers joints and is part 1 of 2. A joint is any place where adjacent bones or bone and cartilage will come together, forming what is known as a joint or an articulation. Joints or articulations can be classified both by how they're put together, which is their structure, or how they move, which is their function. The amount of movement at a joint is related to the way that it is built and the functional requirements of that area of the body. The elbow joint is a classic hinge joint that allows the arm to bend and straighten, whereas the shoulder joint is a classic ball and soccer joint, which allows the greatest range of motion. Joints can be classified either according to their structure or according to their function. Structurally, there are 3 main categories of joints, including fibrous joints, cartilaginous joints, and synovial joints. There are subcategories within these 3 main categories. When we name a joint according to its structural classification, we always use 2 words. Make sure you know the 2 words that are included in the structural classification of a joint. Functionally, there is some debate. There are some scientists that say synarthrotic joints truly don't exist because all joints have some motion, even if it's very slight. However, I would like you to understand the terms listed under the functional categories. Synarthrotic joints, or joints that are classified as synarthroses, mean that the bones don't move relative to one another. Amphiarthroses or amphiarthrotic joints are slightly movable, whereas diarthrotic joints, otherwise known as diarthroses, are freely movable. All synovial joints are diarthroses. That you should know. It is applicable all the time. There is no debate. Understand that the word synarthroses is plural. The singular form is synarthrosis. When you hear the term synarthrotic, that is an adjective describing the joint. So a synarthrotic joint, or a joint that is a synarthrosis, is a joint which is immovable. Amphiarthrosis means that it is slightly movable. Diarthrosis means that it is freely movable. Usually, fibrous and cartilaginous joints are classified either as synarthrotic or amphiarthrotic joints, whereas all synovial joints are classified as being diarthrotic or freely movable. Looking at this picture, I can actually show you where the debate comes in. They're demonstrating the sutures holding together the bones of the cranium as synarthrotic immovable joints. Technically, those joints are held together by fibrous connective tissue, forming what's known as a sutural ligament. I happen to know people who adjust the skull. The skull cannot be adjusted or moved if there's no movement within that fibrous connective tissue. And technically there is. It's very slight, but that's where the debate comes in. Here's another example of something that you might be able to relate to. Teeth are a fibrous gomphosis, and if you were to hold one of your teeth and wiggle it, you'd notice there's some very slight movement. Technically, the joint is supposed to be synarthrotic. I will not test you where there is a debate. You should know that all synovial joints are diarthrotic joints, or diarthroses. When we classify joints according to their structure, we use 2 words. The first word is always going to be the main category of the structure of the joint. In other words, what holds the joint together? The 3 main categories of structural classification for joint include fibrous joints, cartilaginous joints, and synovial joints. Because there's debate about immovable joints versus joints that are slightly movable, I will never ask you a question on what joints are considered immovable or slightly movable. Please know that synovial joints are freely movable. They are diarthrotic. Fibrous joints are named so because they are connected by fibrous connective tissue. You've already seen examples of an interosseous membrane that occurs between the radius and the ulna in the forearm and the tibia and the fibula in the leg. Those are considered fibrous joints. Cartilaginous joints are joined together either by hyaline cartilage or fibrocartilage. You'll remember there are only 3 types of cartilage. We have hyaline cartilage, fibrocartilage, and elastic cartilage. Elastic cartilage does not make up a cartilaginous joint. Lastly, we have synovial joints. Synovial joints are the most common type of joint in the human body. The surfaces of the bones are not directly connected to one another. Synovial joints include a joint cavity. Remember, a cavity is just a space, which is filled with synovial fluid between the bones. Let's first look at the subcategories of fibrous joints. On this picture, you'll see the word synarthroses. However, we've already discussed the fact that these joints are slightly movable. The first type of fibrous joint is the fibrous syndesmosis. You'll see the word syndesmosis on the far left at the bottom of your slide. That literally means with ligament. And there is an interosseous ligament, which we've also seen described as the interosseous membrane, that connects the tibia and the fibula, as well as the radius and the ulna. So those are examples of fibrous syndesmoses. You can also see other joints at the proximal aspect of the tibia and fibula, as well as the distal aspect. Those are also examples of fibrous syndesmoses. Fibrous joints always use ligaments to connect bone to bone. We have the fibrous syndesmosis. Another type of fibrous joint is specific to the skull. It is known as a fibrous suture. Sutures are the description of the connection of skull bones, and fibrous sutures are formed by tiny little sutural ligaments found in between the bones of the skull. The third type of fibrous joint is the fibrous gomphosis. A gomphos is literally a bolt, and fibrous gomphoses are found where teeth sit in the alveolar sockets of the maxillae and the mandible. We know that the fibrous gomphosis is formed by a periodontal ligament that holds the tooth in that alveolar socket. If you've ever been awake for a tooth extraction, you may have heard the tearing of the periodontal ligament. It's very strong. There are 2 subcategories of cartilaginous joints. We have a cartilaginous synchondrosis, which is a joint that's held together by hyaline cartilage, and we have the cartilaginous symphysis, which is a joint held together by fibrocartilage. In the top two pictures, we see examples of cartilaginous synchondroses. The first one on the left is a temporary cartilaginous synchondrosis that is formed by the epiphyseal plate holding two pieces of bone together. Another example of a cartilaginous synchondrosis is the joint between the first rib and the manubrium of the sternum. There is some debate about the other ribs forming synovial joints, so please stick with the joint between the first rib and the sternum as being an example of a cartilaginous synchondrosis. A cartilaginous symphysis is a joint that will only occur in the midline, and we know that the intervertebral discs are made up of fibrocartilage, as is the pubic symphysis, also made up of fibrocartilage. The term symphysis is in the name pubic symphysis. So the intervertebral discs and the pubic symphysis form cartilaginous symphyses that are made up of fibrocartilage, whereas the cartilaginous synchondroses contain hyaline cartilage. Synovial joints are the most common type of joint in the human body. Synovial joints include an articular capsule which surrounds the joint space. This articular capsule has two layers. It has an outer fibrous connective tissue layer, which you'll remember is dense irregular connective tissue. The inner layer is referred to as the synovial membrane. The synovial membrane contains cells that produce and secrete synovial fluid, which is a thick, slimy fluid that fills the space of the synovial cavity. You'll also notice on the ends of the bones there is articular cartilage known as hyaline cartilage that can be found here. Pay attention to this picture. You'll notice that the synovial membrane attaches directly to the bone at certain places. This is an important concept when we start talking about different types of joint pathologies, such as rheumatoid arthritis. As we mentioned previously, the cells within the synovial membrane produce and secrete synovial fluid. This fluid consists of hyaluronic acid, proteoglycans that are secreted by fibroblast-like cells. This fluid reduces friction and absorbs shock. The synovial fluid also helps to supply the chondrocytes in the articular cartilage with oxygen and nutrients and helps to get rid of or remove carbon dioxide and waste. The articular cartilage acts very much like a sponge. So every time there's compression or pressure on the articular cartilage, when the joint is compressed, that squeezes the synovial fluid out of the articular cartilage. And then when pressure is released off of the cartilage, that allows synovial fluid to go back into the cartilage. And that's how the chondrocytes get their oxygen and nutrients and also are able to remove carbon dioxide and waste products. Synovial fluid becomes less thick or viscous with exercise. Think of oil in an engine. When you first turn on the car in the morning, the oil is very thick, and as it warms up, as the car motor runs, the pistons in the engine are moving more easily as the oil becomes less viscous. There are many things that hold synovial joints together depending on the size and complexity of the joint. Remember that fibrous joints are held together by fibrous connective tissue or ligaments. Cartilaginous joints are held together by cartilage. Synovial joints may have different components of the others incorporated into them. They're much more complex. Holding joints together in terms of synovial joints includes the articular capsule as well as ligaments. These ligaments allow for movement but also limit the range of motion that can occur to prevent excess or abnormal motion. Ligaments are classified based on where they are in relationship to the joint capsule. If a ligament is outside the joint capsule or articular capsule, we say it is extrinsic. If it is part of the joint capsule, we say that it is intrinsic. It's built into the joint capsule. If it is actually inside the joint itself, inside the capsule, it is referred to as within, intracapsular ligament. Now, in this picture, we see an intracapsular ligament. Actually, there are two in the knee. We have the anterior and the posterior cruciate ligaments. We see extrinsic ligaments in the form of the medial collateral ligament, which is also sometimes referred to as the tibial collateral ligament because it helps to join the femur to the tibia medially. Remember, the tibia is medial in comparison to the fibula. On the lateral aspect, we see the lateral collateral ligament or fibular collateral ligament. Both the medial and lateral collateral ligaments are extrinsic ligaments. They're outside the joint capsule. The lateral collateral ligament, by the way, is sometimes referred to as the fibular collateral ligament. Okay, so we have the tibial collateral ligament medially and the fibular collateral ligament laterally. We also have, in some instances, tendons attaching muscle to bone, holding the joint together. The word bursa means purse. Bursae are simply fluid-filled sacs that are lined with synovial membrane. Therefore, they have synovial fluid within them. Bursae help prevent friction between skin and muscles or tendons and underlying bones. Sometimes bursae are named according to a particular structure within a joint, or sometimes they're simply named according to where they are in relation to other structures. For example, a subcutaneous bursa is a bursa found just under the skin, such as is the case with the prepatellar bursa. It is just under the skin, therefore is a subcutaneous bursa. A submuscular bursa would be a sac of synovial fluid found just underneath a muscle. The suprapatellar bursa is an example of a submuscular bursa. A subtendinous bursa would be a bursa under a tendon, which is what we see in the case of the infrapatellar bursa. It is under the patellar tendon, which is sometimes referred to as the patellar ligament. Occasionally, a bursa may become inflamed, causing a condition known as bursitis. The suffix itis simply means inflammation of. Bursitis is inflammation of a bursa. We can see on these pictures that with bursitis there may be swelling, which is rather obvious. pain, tenderness, joint stiffness. With swelling, there may be redness and heat. The most commonly affected joints in the body in terms of bursitis include things like the knee, the elbow, the hip, and the shoulder. Bursitis can be caused by trauma, overuse of certain muscles, excessive prolonged pressure on skin, rheumatoid arthritis, infection, or gout. Tendon sheaths are very similar to bursae. They are elongated, fluid-filled sacs that surround tendons where tendons cross joints. Because tendon sheaths are filled with synovial fluid, it helps to allow for a smoother movement of the tendons where they cross joints, and it allows them to glide through much more easily. Arthritis is simply a term for inflammation of a joint. However, not all forms of arthritis are inflammatory. Osteoarthritis is a great example of that. Osteoarthritis is often seen in people who are elderly or may be associated with abnormal wear and tear. If a person has abnormal biomechanics and does repetitive motions, that can bring on osteoarthritis earlier in life. Osteoarthritis is often associated with joint pain that is more prominent in the morning and then eases up as a person goes throughout his or her day. Gout is a type of arthritis where uric acid crystals precipitate out of the bloodstream around joints. It doesn't happen within a joint, it actually happens around a joint. And the gouty tophus, which is a mass of uric acid crystals, when that presses on the joint, it causes the tissue underneath it to die. We call that pressure necrosis. And the gout will actually erode the joint and the bone as it presses inward into the joint. Oftentimes, people who have gout will experience gout in the big toe. It can be so painful that a person may describe a breeze blowing over a big toe that is ridden with gout as feeling as if a knife is cutting through it. Gout can happen anywhere in the body, though. Rheumatoid arthritis is an autoimmune disease where the synovial membrane, instead of producing synovial fluid, produces granulation tissue called pannus. And as the body sends in macrophages to eat away the pannus, it starts to destroy the synovial membrane from within, eats away at the bone to which the synovial membrane attaches, and eats away at the articular cartilage, protecting the ends of the bones within a synovial joint. With rheumatoid arthritis, we see uniform destruction of the joint space. So uniform loss of joint space. We see erosion of the bone. And as the joint becomes very unstable with all of the erosion that occurs, the body in response will sometimes create new bone to fuse the bones together. Anytime fusion occurs at a joint, that is a process known as synostosis, a condition of being with bone. So synostosis can happen with rheumatoid arthritis to fuse the bones together when they're so unstable. Synostosis occurs at the epiphyseal plate. Eventually, when the bones are finished growing longitudinally, where hyaline cartilage is replaced with by bone, we have a synostosis, because eventually that growth plate closes to form an epiphyseal line. Another place where a synostosis occurs is between the two portions of the frontal bone. The frontal bone has two large portions that will fuse together right here in what is known originally as the metopic suture fuses together, so there is no suture between these two large areas of the frontal bone as it is forming. So a synostosis is a bony fusion. Sometimes that occurs naturally, sometimes it occurs as a result of a pathology.